Hi everyone, this is Shubhashini, and first of all, thank you very much for all the love that you have shown me. And I have received a lot of DMs from mostly mothers who have reached out to me to show their support, um, which I'm really grateful for, and also some uh, mothers who have reached out to me to seek help, which also I'm really thankful for, that I can be of any help to them. So today before I continue my story, my experience of the delivery and after that what happened, I want to talk about two things. Probably this video will also be a little long and I'll have to post it in parts. Please bear with me. The first thing I want to talk about, why I'm talking about these things are because I'm getting a lot of questions about these things and people are getting scared, I feel. Yeah, so the first thing that I want to talk about is the gestational diabetes thing that I was having, and how it is different from other gestational diabetes, which is pretty common for a lot of people nowadays. And another thing I want to talk about, the diagnosis of PWS in during pregnancy. So see, gestational diabetes is not very uncommon nowadays. First, let me be clear. When you go to the doctor during pregnancy, I think in your first or second visit, they will ask you if any of your family members, like in your heredity, if you have any diabetes or a blood pressure or something. In my case, my mother and father, thankfully, they didn't have diabetes or any blood pressure issues, high BP like that. Nothing relevant was there. Even then, I got the diabetes. Okay. Second thing, gestational diabetes, even my sister-in-law had. We have three girls in our family. My sister-in-law has two, and in both the cases, in both the pregnancies, she got diabetes. The first time, it was controlled by metformin only, and the second time, she couldn't control her diet because she is a working woman and it was getting difficult for her. So she was taking insulin, but it was only for 2 to 4 units, where in my case I was taking up to like metformin didn't work for me at all, and I was taking till during end I was taking around, I told, 140 160 units, that two different insulins, insulin R in morning, afternoon, and dinner, before dinner, and then Basilog. I in last video I told Besofil or something, I got confused. It is Basilog that I was taking during bedtime. And after that, also my this blood sugar level was not under control. Today only I have shared my sugar chart with someone who was actually scared because she also has this gestational diabetes, and when I showed her, she actually told, yeah, my post meal levels, blood sugar levels were too high. I'll tell you, while fasting, that means early in the morning, your sugar level, blood sugar level is supposed to be below 95. Okay. Sometimes my blood sugar fasting levels were a little less, around 91 92, but most of the times it was above 105, 104, 106, 107, like that. But and also post meal, as far as I know, post meal after an hour, your blood sugar levels are supposed to be 120 140, if I'm not wrong, and after 2 hours it is supposed to be within 120. In my case, first hour it was sometimes 172, 192, and suddenly during the second hour it used to reduce up to 189. And it so happened that sometimes when I talk to my endocrinologist, that there is a peak and there suddenly it is falling. Then she told, okay, when it is falling to 2 digits post meal also, because of my insulin doses, I was somehow unable to this standardize the dose. So sometimes my endocrinologist told, if you see that after 1 hour or 2 hour your this blood sugar level fell down to 80 or 90, you just have a banana or something like that. So it was insane. It is not the case with everybody. And I'm not sure if it is related to my daughter's condition. Now that I think it might be, I'm not sure. And that time even the doctor didn't feel this, because I don't know if why it happened. Let it be. Another thing that I forgot to mention, that after 30 weeks, because I was having scans every week since 27th, every week twice, sometimes growth scans, sometimes just AFI Dopplers. After 30 weeks, your AFI is supposed to be within 25 or so, but after 31st weeks, my AFI was coming up to 29, 30. I was at total bed rest. The amniotic fluid was too much, and now I came to know that sometimes this polyhydramnios this is linked to the genetic condition of the baby. Also, I came to know about it very late, so I don't see any point there. Yeah, so what I'm trying to say is my case of gestational diabetes was really different than anyone else, and you don't have to worry about it, because don't compare yourself with me. I'm just sharing my experience, and I'm just telling you what you should be aware of, or what you should keep an eye on, because I have heard, or I have seen so many people getting diabetes during their pregnancy, and it is very easily controlled with diet, if not metformin, or if not very low doses of insulin. It is not like what I had. And the funny part is, as soon as my daughter got delivered, the next time they did the the blood sugar test, post meal and the fasting, everything was below the highest range it's supposed to be. And also, you trust your doctor. If anything is supposed to go wrong, or if anything, if your diabetes in on that level, your endocrinologist will most certainly tell you. Okay, so this is what, if you have gestational diabetes, it doesn't correlate with your baby's genetic condition. If there is something, the doctor will tell you. Okay, and also some like in my case, it has happened. Everything was too late, and it is probably, I don't know why it is, but yeah, don't just be so don't compare your situations with me. This is about the gestational diabetes. Now let's talk about the diagnosis of PWS during pregnancy. See, Prader-Willi syndrome is not one of the syndromes which is so easily caught during in pregnancy, because there are certain things, like if you're suppose in prenatal scan, if your baby is moving too less, the movement is less, the doctor tells you to keep count, right? The movement is too less, it can be a sign of this PWS or any genetic condition. Sometimes hypotonia can be diagnosed, I guess. It is related to the low movement of the baby. Other thing is the intrauterine growth restriction, which I was diagnosed with at 27 weeks. Okay, these are certain things which could be related to some genetic conditions like PWS, but these are not definitive tests. Like even if they see something, they will suggest you to do some other tests. Okay, now let's come to the non-invasive tests, which are this NT-NB scans. Okay, which was normal for me. Then double marker test. Double marker test only checks for 3 genetic disorders, which are like Down syndrome, Edwards syndrome, and something called Patau syndrome. I'm not sure. There are 1,000 other genetic conditions which cannot be diagnosed through double marker test. Okay. Now there is another test which is non-invasive prenatal testing, that is called NIPT, which can sometime pick certain genetic conditions, but not always PWS. I'll tell you why. There are different types of PWS. Okay, in one type, which is the most common type, there it is a case of deletion. A particular region on the chromosome number 15 gets deleted due to mutation, and that can be picked up by NIPT. That also, I think not all the, it needs some special panel or something, I'm not sure. But there are other types of PWS where the sequence of the that particular chromosome is not changed, and I don't think this NIPT can be picking that. Yeah, so even if NIPT picks up any genetic issues or any abnormalities in the fetus, it has to be confirmed, okay, because these tests are not definitive. So there are two tests as far as I have read about. It is called CVS, and another is amniocentesis, something. There they check the amniotic fluid. I'm not sure what the name actually is. I'm not a medical professional. See, but these tests are done when it is absolutely needed. Like if you have a relevant history, like in my case, it was my first child. So I didn't have any genetic condition in my family. Nobody had it. In my husband's family also, nobody had any genetic condition. So there was no point for me to go through all these invasive tests. But if I conceive the next time and there is a history of me having a child with PWS, that time they will have to consider doing all these tests for me. Okay, so what I'm trying to tell is there is even if it was there was, I didn't know that my baby was PWS, and I don't blame anyone because this didn't fall under the protocol. The standard protocol didn't, include those tests to identify. Whatever was the standard protocol, it was followed. And until and unless there is a need, I don't think any of the doctors will tell you to do all these tests. So yeah, that's what. And also I just want to tell you ki if there is something, you discuss with your doctor. If you just trust your doctor. And also certain times it so happens all the tests that you are given, all the diagnostic like tests or whatever that you are going through during pregnancy, you are doing in the pregnancy, almost they are all 98-99% accurate. That 1% is still remaining. So you have to leave certain things to fate. I'm not telling that something bad will happen or something like this will happen to anybody, or I regret not doing those tests. No, it's not like that. Neither do I regret, nor do I blame anybody. It is as it is supposed to be, and yeah, I am okay with it. And there was no way that they could, identify PWS during my pregnancy. So yeah, that's it for today. Thank you. I will talk about what happened after delivery and how it got diagnosed in the later videos. Thank you so much.